Assalamu alaikum. My name is Dr. Asad Mahmood Khan. I am working as a PGR in the IUN 2 of the LGH. The topic which I am going to present is suture material used in ophthalmology. Now, what is the suture? Suture is basically a needle attached to a thread which is used to hold a wound together in good position until the natural healing process is well established to make the support. This is the simplest definition which I found. Now, what are the properties of the suture? It is absorbability, tensile strength, knot strength, configuration, elasticity, capillarity, and the tissue reactivity. Now, what is absorbability? It is the duration of the suture degradation within the tissue. How the degradation happens? It is by two methods, enzymatic and the hydrolytic. Tensile strength, it has an inverse relation with absorbability. If the absorbability is fastened, the tensile strength will decrease early. What is tensile strength? It is a duration of suture holding strength within the tissue. Knot strength, force required for the knot to slip. Configuration is monofilament, multifilaments. Elasticity, degree of suture stretches and turn to original length. What is capillarity? It is the extent to which the absorbed fluid transferred along the suture. It is happening in the multifilament suture, not in the monofilament. Tissue reactivity. Tissue reactivity is peak inflammatory reaction in the first 2 to 7 days when the neutrophil is active. Now, tissue reactivity usually happens in the absorbable suture, not in the permanent suture because they are inert. What are the ideal suture properties? It should be handled comfortably, allow secure knots, easy sterilization, have no electroallergenic capillarity or the carcinogenic action, have adequate tensile strength, should be absorbed after serving its function. Till now, no suture has all the ideal properties present in. Now, we divide the suture into absorbable and the non-absorbable. What is absorbed suture? It loses most of its tensile strength within 2 months. Tensile strength in the non-absorbed suture remains for several months. Even sometimes in some suture, it is permanent. I previously explained it undergoes enzymatic or the hydrolytic degradation. The time it takes for the absorption vary with the type of the suture. Non-absorbed suture usually does not degrade or there is very small degradation. There is no foreign body left within the tissue. In the absorbable suture, foreign body is left in the tissues. There is marked inflammatory reaction with the absorbable suture, and with the non-absorbed suture, there is minimal or even no reaction because it is inert. Now, there is another differentiation between the suture is monofilament and multifilament. The monofilament suture is usually smooth, multifilament is porous. It does not support the bacterial growth. Monofilament suture does not support the bacterial growth. As in the multifilament, there is a potential space which acts as a nidus and they help in the growth of the bacteria. There is no capillary action with the monofilament, but the capillary action is present within the multifilament, and the same reason behind that is that there is a potential space present within the different parts of the thread. It is usually monofilament, slippery, stretch, and difficult to handle. Multifilament is not elastic, easy to handle with the safety time. Has stiff ends. Monofilament have the stiff ends and cause irritation if the knot is not buried properly. The multifilament is usually soft, pliable, well tolerated by the patients. This is the picture which is showing the monofilament and the multifilament sutures. Now, how we measure the size of the suture? Suture size is measured by two methods. One is the USP and the other one is the metric gauge. Currently, in the modernized countries, developed countries, metric gauge is superior over the USP because it actually tells us about the millimeter of the sutures. For example, if the metric gauge is 0.2, the size is about 0.02 mm. We divide the metric gauge by the 10 and we will get the size in the mm of the suture. USP more commonly used in our country. It is basically, for example, if the suture is 10-0, it means it has a 10 zeros in that and the size is small. If it is 6-0, the size is larger. If we increase the number of zeros, the size will be decreased. We can say the size and the zeros have the inverse relation. Now, these two slides will show what type of suture we are using in what type of tissues. For example, 10-0 is usually used in the cornea, 9-0 is used in limb and the conjunctiva, sclera use 8-0, 7-0 is the muscle, conjunctiva and the eyelid skin. And 0-0 is used in the extraocular muscle isolation. 1-0 uses stage suture. These are different types of needles which we use in the surgery: taper point, taper cut, spatula, reverse cutting, prime reverse cutting, prime conventional cutting, and the center point spatula. And its uses are also written in the second column. For example, in the taper point, usually aponeurosis, dura, fascia, muscles, nerves, subcutaneous fat, and the vessels. Spatula is usually used in the cornea, sclera, very commonly used in our surgeries. For example, in the extra cap, and for example, while tying the sclera after any retinal surgery. Now, when we see the packing, what we see in the suture, initially there is size, which is 30. This is imperial gauge, USP gauge. Just below that, the metric gauge is also written so that we can see what is the size of the suture, and from that we can measure the size of the suture in the mm. Below that, the needle shape is shown. What is the tip of the shape? For example, in this case, it is reverse cutting. It is inverse triangle, which shows reverse cutting. Below that, there is a size of the needle tip, which is about 9 mm in this case, and below that, the size of the suture is shown, which is 45 centimeter. And the next couple of slides, I will show different suture packing, and if we are seeing what type of the you can say needles shape, so that we can see from that. For example, this is a chromic gut. It's about 50. It is absorbable suture. Monofilament diameter is about 50. Needle shape is round. This is athlon. Athlon is basically non-absorbable suture. The size is about 20. It's monofilament, and needle is reverse cutting. It's opposite triangle. Perma hand silk. It is non-absorbable multifilament. Diameter is 5.0, and the needle is conventional cutting. Conventional cutting is a straight triangle. Vital, very commonly used here. It is 60, absorbable multifilament. Diameter 60. Needles is usually spatula used. Proline, second most commonest, non-absorbable suture, monofilament. Diameter is about 10, needle is spatula. Neurolon, it's a non-absorbable suture. It is multifilament. Diameter is 0. Very large diameter. Needle is taper point. And monoacral, absorbable suture, monofilament. Diameter is 50. Needle is reverse cutting. Fast absorbing plain gut. It is a straight triangle, so it is a conventional cutting suture. Diameter is about 50. Monofilament, and it is absorbable suture. Thank you very much. This is my presentation.